Okay, this presentation is in regards to the ASC Quality Reporting Program at Riverside Surgical Pavilion. The purpose of this video is to take a look into the Quality Measure Data Reporting Program for ambulatory surgical centers implemented by CMS. The purpose of this video is to familiarize ourselves with the Ascqr program to ensure we are meeting program requirements. So our first objective here is to introduce and define CMS's quality reporting program, the Ascqr, to clinical and administrative staff. We will also examine the measures, reporting requirements, and methodologies of the Ascqr program. And finally, we will assess how paying for value through the VBP program has influenced quality of care in the U.S. healthcare system. So what is value-based purchasing? VBP is a program initiated by CMS as part of the Affordable Care Act of 2010 that rewards healthcare facilities with incentive payments for the quality of care provided. VBP rewards healthcare facilities based on the quality of care provided to Medicare patients, so a portion of payments are now based on the quality or efficiency of healthcare delivery. CMS can withhold Medicare payments by 2% if we fail to meet the VBP program requirements. Ultimately, CMS's goal for the VBP program is to improve the quality, efficiency, and patient experience and safety of Medicare beneficiaries. Now, what is the ASC quality reporting? ASCQR is a type of VBP program specifically for acute surgical centers like Riverside. ASCQR program exists to promote higher quality, more efficient health care for Medicare beneficiaries through data reporting, quality improvement, and measure alignment with other clinical care settings. ASC submit data for quality measures via the web-based tool on the QualityNet secure portal seen here on the right. The ASC quality measures are depicted here. If you notice, there are 5 main program requirements, which we will discuss in the next slide. The first quality measure is the ASC9, or endoscopy polyp surveillance, which is the appropriate follow-up interval for normal colonoscopy in average-risk patients, which is a web-based measure reported in QualityNet. The second quality measure is that of cataracts, which the goal is for improvement in patients' visual function within 90 days following cataract surgery. This measure is voluntary. The third is the facility's 7-day risk standardized hospital visit rate after outpatient colonoscopy. For this measure, data will be pulled from claims previously submitted by the hospital that the patients visit within 7 days of the colonoscopy. The fourth is normothermia, which is used to assess the percentage of patients having surgical procedures under general or neuraxial anesthesia of 60 plus minutes who are normothermic within 15 minutes of the arrival at the PACU. And lastly, we have the unplanned anterior vitrectomy, which is used to assess the percentage of cataract surgery patients who have an unplanned anterior vitrectomy. So the data collected through the ASCQR program is publicly reported, so people with Medicare and other consumers can find and compare the quality of care provided at the ambulatory surgical centers. Publishing these data can improve facility performance by providing benchmarks for selected clinical areas and public view of facility data. The public ASCQR quality measure is found on the CMS's Hospital Compare website, seen below here. And lastly, we will discuss the value of the value-based purchasing. Although several studies agree that the evidence on the effectiveness of VBP programs is mixed and modest, many argue that most studies were over a short time frame, whereas a longer study may allow for better observation or outcomes. But empirical findings have revealed that VBP on average drives penalized hospitals to act in manners consistent with the program's underlying objectives. So these facilities are likely to improve processes in ways that enhance hospital operational outcomes and financial revenues. Ultimately, despite some of these studies, CMS urges that value-based purchasing programs eliminate or reduce adverse events, adopt evidence-based care standards and protocols in order to obtain best outcomes for Medicare patients, incentivize facilities to develop processes that improve patient experiences, increase transparency of care quality for consumers, clinicians, and others, and lastly, recognize facilities that provide high quality care at a lower cost to Medicare. Lastly, we have any additional resources where you can visit for more information on the ASCQR.